Our physician colleagues and patients are going to be looking for more information than a traditional pathologist provides. They need to be able to incorporate information from genomics, from molecular pathology, from ancillary tests that are available through the electronic medical record, and they need to integrate this information to provide a better diagnosis and more information associated with a diagnosis so that the patient can be treated appropriately. Informatics as it applies to the pathologist, I think really can be split into two different areas. The first is as an enabler to help the pathologist perform tasks that they perform on a daily basis. So to help them perform diagnoses more accurately, more efficiently, with better communication, having more data available to them, having access to the data that they require in order to ensure accuracy, having the QA information, quality assurance, having turnaround time available to them, making them aware of how well they're correlating with other aspects of the medical record, improving their ability to interact with other physicians to communicate important alert values, I think are all aspects of information management and informatics that many folks do not consider a part of the healthcare system enterprise or effort that they can have an impact on. But in fact, pathologists are key, are instrumental to having impact in these areas because they produce so much of the data that goes into the electronic medical record. So the second piece of informatics and the pathologist relates to communication of our bread and butter, our product, which is our pathology report, to our physician colleagues that are reading and interpreting that report, as well as now, in today's day and age, directly to patients through electronic patient portals. In regards to genomic medicine, there are multiple new sources of data that the pathologist must correlate and integrate into their traditional pathology report. The pathologist must identify those elements of a genomic analysis that are relevant to the diagnosis, be able to combine that with the diagnostic information that is traditionally conveyed by a pathology report, and then present it to the clinician in a way that's understandable and in a way that allows them to make the appropriate treatment decisions. This type of interaction is brand new. It's not something that traditional pathology or pathologists have had to deal with. It's not an aspect of our training that is a current part of the curriculum. So this is an area where our specialty needs to transform to deal with new enabling aspects of technology that take our traditional pathology report and put it into the hands of individuals that normally would only be receiving and interpreting that report through another person, another physician, an oncologist, a surgeon, a internal and internist at a hospital would be translating that information to the patient. Now, a pathologist is communicating directly to the patient via an enabling technology such as a patient portal.